This is not ethical. This is negligence. It's really messed up. I have an issue with this. Tell Gilead you have an issue with this. Hey everybody, it's Dr. Z here, back again for another video. Today I want to talk about Truvada and Descovy, which are two drugs approved for pre-exposure prophylaxis for HIV. So that's HIV prevention. It's a pill that you take every day to prevent HIV. I also want to talk about Gilead, which is the pharmaceutical company that manufactured both of these drugs. So there's a little bit of controversy right now because Gilead is actually facing many lawsuits countrywide right now because Truvada has side effects, kidney problems, problems with bone mineralization, which can lead to osteoporosis, and then also like upset stomach and things like that. Truvada was first FDA approved for PrEP between 2012. Right? So 8 years ago. Truvada has two drugs in it, emtricitabine and TDF, which is a form of tenofovir. The issue is that a newer form of tenofovir, TAF, was approved in 2016 for HIV treatment, not for HIV prevention. However, the drug was studied and known to act similarly to TDF, but had a sixth of the side effect profile. So the kidney problems, the bone problems, the stomach problems that I talked about earlier, it has those, but at a sixth of the rate. So it's pretty significant, right? The issue is that was approved in 2016. Truvada's patent expired. So a patent is the amount of time that a company that manufactures a drug can sell it exclusively before other companies can also manufacture it and sell it themselves. Well, Truvada's patent expires either at the end of 2020 or the beginning of 2021. Descovy, which is Gilead's second PrEP drug, which has the same emtricitabine but the newer form of TAF, was approved a couple months ago, like the end of 2019. Conveniently, a couple months before their patent on Truvada runs out. There's a gap there. There is a period in there where they had that drug ready, they had that new drug ready, but they didn't release it because they wanted to get the most out of Truvada. They wanted to milk the patent for all it's worth, make even more billions of dollars, knowing that they had a safer drug available and that there are people out here having bone issues, having kidney issues, having stomach issues, and just letting that happen. So that's a problem. In research, in science, and medicine, we have principles that govern the way that we operate. And one of those is do no harm, or non-maleficence. This is the principle that we don't want to harm our patients. You know, if we have an older drug that works but has some side effects, it's the best thing that we have, of course we'll do it and we'll counsel people on the side effects and do our best to manage them. But if a newer form of the drug comes out that's better, the ethical thing to do, right, is to recall that first drug and put out the next one. Whenever we do clinical trials and we see a benefit for the newer drug, we'll stop the trial so that the people who are getting the old drug can just get the new drug. We're not trying to harm people. However, Gilead did not do that, and that is a problem. That is the main reason why our healthcare system is so toxic and negligent, because at the end of the day, our healthcare system is about making money, not about making people healthy. So these lawsuits are claiming just that Gilead had TAF, the form of tenofovir that's in Descovy, they had that approved and ready to go, but they withheld it until their patent for Truvada was about to expire so that they could get as much money out of Truvada before releasing the new drug that then would have its own patent that they could also then, you know, get as much money out of as possible. This is not ethical. This is negligence. It's really messed up. There are a lot of people who had consequences from these drugs, and Gilead knew that this was happening and didn't recall the drug. And there's nuance to that, right? Because Truvada overall is a safe drug. You know, no one's dying from it, but it speaks to a larger principle in pharmaceuticals and in healthcare in general, that it's really about the money and not about people's actual lives. And that's where the issue is, and that's why these lawsuits are open. I have an issue with this. Tell Gilead you have an issue with this, and we need to call that out. It's not normal. It's not normal. It's not okay. Especially because, you know, the people who take this drug are marginalized populations. These are people who are IV drug users, these are MSM population, these are sex workers, these are trans people, these are people who deserve to have people looking out for them and not being exploited. And you know what also got on my nerves too is that some people think that Gilead, because they have this fee assistance programs that you could apply to and they'd help you pay for the drug. That wasn't some like goodness of your heart to like, oh, let's give this out for people. Like, no, because they're already making billions off of the drug, they have to offset it somehow with their little philanthropy. Like, oh yeah, we're making a lot of money, but let's give some away too. Like, it isn't like this benevolent, like, oh, let's make sure everyone has access to this drug, which is how it should be, specifically because PrEP is a drug that prevents HIV. If people don't have access to it, what is the point of it? The point is that at-risk populations need to be able to protect themselves from it so that HIV doesn't spread even further. So I hope that Gilead pays out billions of dollars to people whose lives were affected by this, and that we demand better from pharma. It's not right.